Okay, we are going to be talking about solution-focused therapy. It is a social constructivist approach. So we're going to talk a little bit about postmodern social constructionism as well before we get into this. So postmodern constructivist approach is all kind of have these same similar kind of premises. They believe that there's no absolute truth. You really can't have an objective truth or an objective reality, because reality building is actually a result of individuals' participation in basically creating a reality. Our perception of reality is the only thing we actually can really talk about, because we don't have an objective truth. We all are just creating realities together. So we all have different slightly versions of reality. And as we talk and discuss things and we create reality within a social discourse, so language has a great influence on our perception of reality. So all of the social constructivist approaches have a lot of these things in common. Those are basic premises of these theories. They all take kind of this not knowing stance, because we can't be an expert in someone else's life. We can't be an expert because there is no objective expert, right? We all are just seeing perceptions of reality. So these tend to be client-led, very collaborative approaches. The counselor tends to be an expert on change, whereas the client is an expert in their life, an expert in what their needs and their version of healthy is. So it's very validating of the client and the client's worldview and the client's view of wellness for themselves. They have a greater acceptance of integrating approaches, right? Because they believe that everyone's approach has some validity, right? So they integrate different approaches of different theorists and different techniques oftentimes. They are focusing on cognitions because they focus on perception, right? The way we think about things, the way that we are talking about things, right, shapes things. So our thoughts definitely are shaping our actions. So they shift our thought patterns. So shift our perceptions a lot of the time is what their change mechanism is. They have, like I said, an increased value on attending to diversity issues, because they do value the client's worldview as an objective or as a valid truth. There's lots of valid truths, right? So they're validating all those worldviews. The client and the therapist alike are empowered, believing their situation is changeable. They focus on expanding clients' rigid and inflexible perceptions or views of their world and their family, and broadening that perspective to see a broader base of the way of seeing the world. So in particular, solution-focused has all of those premises, and then we're going to get a little bit more detailed into how solution-focused is constructivist. So the leading figures in particular, C. Shazir and Inso Berg. Those are the two kind of that formulated and created solution-focused as it is. There are some others there, Weiner Davis, Yvonne Delon, Eve Lipchick, Scott Miller, some others that have kind of taken solution focus and put it into different situations in particular, and kind of specialized it for certain populations, things like that, and have adapted it some. So a few different approaches out there that we'll talk about a little bit. Clinicians tend to draw from the MRI model. They broke off due to agency constraints and formed the Brief Family Therapy Center. So this is very much influenced by Milton Erickson's pragmatic ideas, some of the communication theories that we talked about earlier, and Bateson's theories of communication. So they'd all work together and kind of all broke off in their separate directions. The theoretical formulations basically are narrow views of problems perpetuate rigid patterns of false solutions. So basically you tend to try to solve the problem the same way over and over again, and it's failing. So if we widen and broaden that view, you might try a different solution. So language of problems is difficult from the language of solutions. Problem talk is negative. It's focused on the past. It implies permanence. You can't change it. Like, it kind of imposes this locus of control. I can't control it. I can't change it. Solution talk is much more hopeful, future oriented, and oftentimes within client's control, right? The basic philosophies of solution focus, it's an optimistic approach to humans. The power of language to create and define reality is really important. There's no absolute truths, thus you can create new ways of viewing your life. So that's the basic philosophy behind the change mechanism here. It sees clients as customers, the problem is a complaint, and the counselor is hired to assist them with that. The assumptions are that clients have resources and the strength to resolve these complaints, and that change is constant. We're always changing. So it's embracing that change process. Counselor's job is to identify and amplify that change. And they don't need a lot to know about the complaint. They don't need to go back into the past a whole lot. They don't have to understand the cause and the function behind the complaint. They just need to focus on the solution, what's going to help them move forward. Because they basically see clients as stuck, and they need to just move forward in that change process. A small change is all that's necessary because it impacts the system and then it creates more change, right? So that because that change process is constantly going on, a small change is a change that changes something else, continues that change. It's just getting them unstuck. Clients get to define the goal or their solution, their wellness goal. Rapid change or resolution is of the complaint as possible. So they believe in this being rapid, that it can happen quickly and you only need a few sessions sometimes. So that's a big part of this brief therapy approach, basically. There's no one right way to view things is important. No one right way to say someone is healthy either. Focus on what's possible and changeable rather than what's impossible or outside the client's control. So they just kind of stay focused on what we can change. Human motivation in general, solution-focused client counselors don't tend to have a lot of theories about human development or human change or human motivation. They're just mostly focused on the client in front of them. So they rather find out what the client wants and how their strengths and resources are going to help them get to that. So that's kind of where they just go, is what the client specifically wants and how they can use what they have, their toolbox to get there. Positive and negative motivations tend to move toward things we want and away from things we wish to avoid. So it's just our natural tendency to move towards the things we find we want and away from those things that we don't. Clients, again, healthy versus dysfunction here. Clients are the experts in their own life. People are resilient, resourceful. Problems are simply normal life cycle complications. That process of change. Clients have the ability to construct solutions, and clients determine what goals are healthy for them. As far as dysfunction goes, solution-focused counselors don't really like to label and diagnose. And they see clients as just getting stuck and that problems are just a part of life and change is a part of life. So they don't like to diagnose. Feels like it draws attention away from people's ability, their solution, their strengths, their resources, if you're just going to diagnose them with this label, right? So they want to see people holistically and not just as their problems. That's really a big part of this theory. They see dysfunction again as a client just being stuck, and they're just assisting them on that change process so they're unstuck. They want clients to avoid problem talk, and they avoid labeling themselves as well in that. So they don't really like to use those diagnoses. As far as the overall goals of therapy, again, they're very client specific, right? Because the client's defining these goals, but in broad-based terms, they want to resolve the presenting problem quickly, the presenting complaint very quickly as possible. They want to focus on what the client wants to change. They want the client to help structure the client to have well-defined goals. So that oftentimes that SMART goals approach is really something that they work on, helping the client set those goals. And overall, they want to change the doing and change the viewing of clients to help them reach those goals that they define. And in order to change the doing and the viewing, they are using the client resources, strengths, and solutions. So they're evoking those things that the client has within themselves or in their world to help the changing and the doing and the viewing, right? To help that change process move along. As far as conditions for behavior change, really you're amplifying the exceptions to the problems. So the times when they're really not yet stuck, or they're really not that depressed or not anxious, or right, the times that they feel like they're functioning well, you can amplify those so they can see themselves more holistically, so they can see their strengths and resources in like widen that perception, right? Shift in the problem is language. So again, using language that promotes change language, positive thinking, getting them to see their resources and their positive strengths and things, getting the clients to talk more positively, thinking more positively, and then acting more positively. So they believe in that that social discourse and making sure the language changes so their thoughts can change, so then their actions can change. Determine what works and do more of it. So a lot of that is just in that progress of counseling. They find what works, they talk about it, they evaluate that progress, and they want to keep that going. The assessment procedures for solution focus are really informal. It's usually a brief description of the presenting complaint or problem, moves directly into how things would be different if the problems weren't solved. So again, you're focusing on solutions. How would things be different if you didn't have this problem? Ask about exceptions to the problem or times when the problem were less severe, times when they were able to cope with the problem better, those sorts of things. Clients are the experts on what they want to change. And the counselor assesses the client's motivation for change. It talks about clients being a visitor, a complainant, or a customer. A visitor is not really that interested in counseling or change process so much. Complainants, basically, they want to just complain and they don't put a lot of action in. So that's where they are in that readiness to change process. And customers are really invested. They have already started to try to come up with solutions. They've tried to enact solutions. They might have already started on that process of change. And the same goes for groups. It's kind of that spectrum, right? So they have those terms there for group therapy as well. The therapeutic atmosphere is that of kind of a teamwork sort of situation. It's a very collaborative approach. You're respecting each other's worldview. The counselor respects the client's worldview. The client's respecting the counselor's worldview and kind of suggestions. The counselor tends to be energetic, positive, upbeat, responsible for the sessions, kind of structuring them, and is the expert in change. Whereas the client is the expert in the client's life and the client's situation. Techniques. These are kind of the most essential ones, the ones you hear about the most as far as when it comes to solution focused. That is goal setting. That is a big part of it, helping the client set those specific goals and measurable goals. Normalizing the problem is just basically suggesting that everybody has problems and kind of complimenting them on their ability to handle the problem so far or to deal with such a difficult situation, right? The scaling questions are here. You usually ask them on a scale of 1 to 10, how difficult is the problem? How difficult is your depression, anxiety, whatever, right? Your symptoms. You can use scaling questions in a lot of ways. And then oftentimes, like if they'll say, my depression's at a 5 today, I feel like it's at a 5. And then you ask, what would maybe move you down or up, depending on where you're putting your scale. So oftentimes I use this in like, how likely are you to do what we've suggested? So how likely are you to exercise twice this week? And they'll be like, I'm like at a 3. And so they say, well, what might move you up to a 4? And I'm like, well, if my friend went with me, right? So it's helping them remove those barriers to getting where they want to go. So there's lots of ways to use scaling questions. I use them a lot in solution focus. The miracle question is basically a what if question, where you're asking like, what if your problem went away? And then what would life look like? So I tend to ask it to my little ones, my little clients, is if I had a magic wand and I waved it over your head and tomorrow you noticed things were different and you knew my magic worked, you just knew what would change, what would be going on that you saw my magic work. Typically the miracle question is like, what if you went to sleep and in the morning your problem was gone? What would you notice was different? So you can use it in lots of different ways, right? Change it up to what fits you and your clients. An exception question is basically finding those exceptions to when the problem really wasn't there. So do you remember a time when you didn't have struggles with this particular issue? Do you remember when you didn't have the problem? Or do you remember when you felt better, or that you felt like you were dealing with this, or the problem was more manageable or you could handle it? Those kinds of questions. The coping questions are basically what they're saying, times when you could cope with it better, and asking about those times, what they were using to cope with the problem or how they were coping with the problem. Compliments need to be very specific and based on the client information given to you. So oftentimes it's compliments on them trying something, trying a task that you assigned in the last session, or the progress that they're reporting they're making. It needs to be very specific and pointing out exactly kind of what they did or the effort that they put in. A 10-minute break and follow-up summary is oftentimes used when you're using a reflecting team, and we'll talk about that a little bit more often, but you can use it individually. It's kind of a time to step away from the client, summarize kind of what your session was about, and then kind of read that summary back to them. It gives them some time to think as well and process the session as well on their own. Techniques that are a little less often used, fast forward questions. Again, it's like the seeing them in the future and what their goals. It's kind of a goal setting question. Externalizing, that's oftentimes taking the problem outside of them. That's often used with narrative therapy as well. So that's a little confusing in here, but that is an integrated approach that oftentimes solution focused counselors will grab from narrative therapy. First session formula tasks, it's just giving them a task that they feel like they can complete pretty quickly. It's to build that confidence. It's something that they're wanting to try or do that you feel like would be really easy, quick, achievable, timely sort of thing to help build the confidence and that help them change quickly. Generic tasks might give them something less specific, more generic. It's pretty, those task things tend to build confidence and help them start on the progress of change. And they're usually very simple things. Breaking patterns, surprise task, write, read, burn. These are all tasks you can look up and read a little bit more. I'm not going to go into them a lot. Anyways, the idea is to shift their doing or shift their language or shift their thinking, right? And that's their perception. Stages of treatment, kind of follow this basic structure. You're basically looking at co-constructing a problem and a goal. So again, in that very first session, you're talking about leading them towards that solution. So you're trying to set goals from the very beginning. You identify and amplify exceptions. The next few sessions kind of helping them define what success has looked like in the past and how they can recreate that again. Assigning tasks, and then also evaluating the effectiveness and like praising and complimenting them on their efforts and the changes that they're making. Reevaluating problems and goals, reassessing is also part of that process. So as far as evaluating the theory, kind of some criticisms and some strengths, weaknesses, it is a relatively new theory. It's attractive due to its brevity. It can be a very brief form of therapy, and it's used in oftentimes those settings where that it may be necessary. You only get 1 or 2 sessions with a client and whatnot. It's oftentimes very attractive for school counselors because oftentimes you're not getting that consistency. You may just have a student drop in, maybe once or twice to deal with something, and you don't see them again. So something like that. Superficial, simplistic, and manipulative is some of the criticisms there, that it's just kind of too simplistic. It doesn't really get into deeper core things going on or causes and things like that. Another one that kind of goes along with that is it tends to be individualistic, and the stance that you have the solution may neglect a lot of environmental factors where the client doesn't have a lot of control over, may neglect some of those systemic changes and pieces there. They can be really difficult and barriers for clients to achieve the wellness goals that they want. Insistence on solution talk may cut clients from feeling empathy from the counselor and feeling heard and understood because you're shifting their language quickly. Qualities of the theory, it can be difficult to operationalize due to it really doesn't have a lot of conceptual theory behind it. It's more a method, an approach. It doesn't have a lot of theory on human development or how dysfunction develops, right? So there's not a lot as far as theory testing to do, but there is some support for its effectiveness. A lot of the research is much more focused on outcomes. There's not a lot of research done on it because it is fairly new, and it tends to eschew away from objective truth and illicit diagnosis and things. So it tends to not be, the people that go into it, researchers tend to not be also solution focused. So it's that kind of struggle with most of these postmodern constructivist approach. Kind of they have this leeriness of being researchers as well. A systematic review did show some support. It reviewed 15 control outcome studies, found some support for solution-focused therapy and its effectiveness. So we're going to quick go over some models that kind of spurred off of solution-focused. I'm not going to talk them a whole lot. I just want you to be aware of them. Solution-oriented possibility therapy. This is some of the people behind it. I'm going to cover it a lot. So it has 7 theoretical assumptions. Resistance is not a useful concept. Change is inevitable. Only a small challenge is necessary. Client have strengths and resources. See, it's very solution focused, right? You don't need to know a great deal about the problem in order to solve it. Multiple perspectives, no single correct view of reality. So that is some basic assumptions of it. Strength is an acronym, also a therapy approach that uses solution focus. It's a trajectory preview. It's an acronym. Resource development, exceptions analysis, noticing positives, goal setting, tenacity review, and human capacity. So it's kind of this therapy approach model that's been systematically put into like a manual, a model you can follow. A collaborative approach is open and make the invisible thought visible, create meaning together, more attitude about technique. It's egalitarian. It's purposeful conversation with family members as they explore the problems and research through understanding and new options. So these are some kind of a collaborative approach with the therapist and family members as well. The Reflectate team is a family systems kind of approach, and you can combine it with solution focus, but it uses that one-way mirror so professionals and families have reverse roles to observe one another. So you can use it at different times during the session to get responses from professionals behind the mirror, so you can get some feedback on what's going on between the counselor and the family members, or the family members. That's when you can kind of do that whole 10-minute break and go talk to them and then come back, right? You're offering tentative hypotheses and speculations about what's going on, shifting between inner and outer dialogue with the family about the teams and the observations that the professionals on the other side of the mirror are seeing. So in summary, solution focus really focuses on doing more of what works. What has been successful in the past, do more of it again. And viewing things different, shifting that problem talk to solution talk. It's very popular today, particularly because it can be a very brief treatment, believes in, it could be worked in just one session oftentimes. So it's the idea of focusing on solutions, moving forward, getting a client unstuck, and just a small change can help them move forward. So you don't necessarily always need a follow-up session. So that is really important, why it has become so popular. And that is in summary. Let me find the